Today I'm going to talk to you about the risks of unprotected sex. Those risks include pregnancy and sexually transmitted infections. The only way to protect yourself 100% is by not having sex at all. In 2019, the CDC provided a survey to high school students. They found that 38% of students have ever had sex. So although it may feel like you're the only one waiting to have sex, you're not. If you decide to have sex, please do it for the right reasons and as safely as possible. Often the first thing that people think about when protecting themselves with sex is protection against pregnancy. Of course, pregnancy is only possible when two partners of opposite sex engage in vaginal intercourse. There are many birth control options available to teens. The pill, the patch, the ring, a shot, and other long-acting reversible contraceptive devices. Please talk to your healthcare provider to decide which is the best option for you. In Ohio, teens have the right to confidential care, which includes care for pregnancy tests, birth control, sexually transmitted diseases, testing, and treatment. The next risk of unprotected sex is sexually transmitted infections. In the United States, 20 million cases of STIs are diagnosed each year. Over half of those cases are of patients aged 15 to 25 years. No sex is free from risk. Some infections can be spread from skin-to-skin contact. Many people don't have symptoms at all. In fact, 80% of people have no symptoms. If you do have symptoms, those symptoms might include burning with urination, penile or vaginal discharge, lumps, bumps, or sores. Some STIs are bacteria. Gonorrhea and chlamydia are the two most common STIs. They can be treated and cured with antibiotics, but if left untreated can have serious complications such as pelvic inflammatory disease, which could lead to chronic pelvic pain and infertility. Another bacteria-driven STI is syphilis, which is not common in adolescents, but is still possible. Some STIs are viruses. Herpes and human papillomavirus, or HPV, are common viruses that cause STIs. These viruses can be transmitted from skin-to-skin contact. Condoms do not always protect against that. The HPV vaccine is available to help protect you against this virus. If you have not received this vaccine, please contact your healthcare provider to get it. HIV is a deadly STI which attacks your body's immune system and leaves it vulnerable to other infections. So how do you protect yourself? Practice abstinence whenever possible. If you decide to have sex, please do it safely. Please don't be under the influence of drugs, alcohol. Use condoms or other barrier methods if you decide to have sex. Please also get tested at least once a year. If you have any questions or concerns about your reproductive health care or want to talk to someone about your risks of unprotected sex, contact your healthcare provider and we're here to help you.